Good morning.
Good morning.
I want to thank you all for coming and helping us communicate and address some of the concerns that our community has about this, well, I want to say little mosquito. It's actually a big mosquito that is responsible for what is called the West Nile virus. Unfortunately, we have confirmed that an 83-year-old Donna resident died Wednesday night of the West Nile virus. There's also another individual, an elderly man from the Pharr area, who has been hospitalized with what is expected to be the second case. Our investigation into these cases is underway. This is the first locally acquired case in Hidalgo County since 2012. And both cases tested as a neuroinvasive, which is the most serious form of this particular virus. The Hidalgo County death is the third West Nile virus fatality in Texas this year. People over 50 and those with weakened immune systems are the most vulnerable. And what we're doing is we're urging our residents to take precautions while they're outside. Just use your basic common sense. The county has been involved in spraying to kill the mosquitoes. They're also going to be larviciding standing water to keep the mosquitoes from actually being born. Each precinct has been notified and will be conducting colonia cleanups as well as mowing tall grass and draining standing water. And school districts, hospitals, doctors' offices, and veterinarians have been alerted. At this time, we've got here with us our health director, Mr. Eddie Olivarez. And Eddie, if you'll go ahead and come on, step forward, please.
Thank you, Judge. Good morning, everyone. My name is Eddie Olivarez. I'm the Chief Administrative Officer for Hidalgo County Health and Human Services. And as Judge Garcia has brought out, that we do have our first cases of West Nile in Hidalgo County. It's been since 2012. I think one of the interesting things that's important to understand is that West Nile, one of the things I was reviewing with the media right beforehand was that West Nile first was discovered in 1937. It came to the United States for the first time in 1999, which is an interesting situation. The mosquito type we're looking at is called a Culex mosquito. That's a mosquito that's pretty common in this area. There's 4 subspecies, and 2 of the 4 subspecies are here in the valley. So we see that. One thing that's very important in your media package, we put that this is a bird transferred illness. West Nile virus is primarily found in birds, and a lot of them, we have a very large migration pattern for birds here in South Texas, we know from our birding industry. So the reality is that the birds are the ones that transmit the illness to mosquitoes. Mosquito will bite a bird, draw the blood, get the infection, pass it to another bird or another mosquito or an animal or a human. So it transfers from bird to mosquito or mosquito to bird to animal or to human. So that's the primary way it transfers. The incubation period could be from 2 to 14 days, depending on the severity of the illness. 70 to 80% of the people will not show symptoms. Okay, 70 to 80% of the folks will not show symptoms. If you're a healthy, active person, you may have it and you'll never know you have it. But this is a concern for the elderly and for people who have immunocompromised illnesses that are very concerned. About 1 in 5 people who are infected will develop a fever and other symptoms such as headache, body aches, joint pains, vomiting, diarrhea, or rash. Most people with this type of West Nile virus recover completely, but fatigue and listlessness will last for several days. There's 2 types of West Nile that we're looking at: West Nile fever, which is the one I just described, and then the next one, the more severe one, in less than 1% of the populations are infected will develop with serious neurological illness, and it's West Nile neurological disorder or disease. And the thing with West Nile neuroinvasive disease, that it will be kind of a meningitis. I'm going to mispronounce it today. A meningitis type of illness where there'll be inflammation of the brain and cause some neurological issues and concerns. That is the most severe type that would cause hospitalization and can really cause some long-term damage. This is the case that happened in these 2 cases. but it's in the symptoms for that. The symptoms of the neurological illness can include headaches, high fever, neck stiffness, disorientation, coma, tremors, seizures, and even paralysis. People with certain medical conditions such as cancer, diabetes, hypertension, and kidney disease are also at greater risk for serious illness. Recovery from the severe disease form of West Nile may take several weeks or months. Some of the neurological effects may be permanent. About 10% of the people who develop neurological infections due to West Nile will actually result in death. So even though it's only 1% of the population that or 1% of the West Nile cases are the neurological type, but there is a 10% incidence of mortality, especially if there's other illnesses accompanied to this. And this is what happened in this situation. We are working hand in hand with our Vector Control Task Force. We've done this in the past where we get our several Cameron County, Hidalgo County, will work hand in hand and bring in all our licensed vector control experts together to come up with an organized plan on dealing with this. We are very honored that we have one of the leading experts in dealing with mosquitoes actually at the state level. He's here in McAllen. Josh Ramirez, the City of McAllen Health Director, is actually considered one of the leading experts in dealing with mosquito-borne illness, and he's actually took part of a task force that dealt with West Nile up in central Texas a couple of years ago. So he and I have already been in contact, and we're going to be having a meeting next Wednesday and bringing all our forces together to coordinate all efforts. The precincts have all committed to helping and assisting with this. We're working with the cities and all the school districts. We send out alerts to cities, to the school districts, hospitals, doctors, veterinarians. Any of you, please take care of your pets. Pets are very, very important in this. If you have horses, West Nile virus is deadly for horses. And it is very important that you follow up with that and making sure you consider your pets in dealing with this. If you're allergic to the DEET spray that you would put on, there is a eucalyptus, more of an herbal natural component. That's a lemon eucalyptus that's used to be a natural preventative method to keep mosquitoes away from you. The main thing is get a physician consult. Now we have flu season coming upon us, so the symptoms are real similar to flu. So all of a sudden you have flu, you have West Nile, and then also in the mid-America you have the EVD 68, which is that virus that's affecting, respiratory virus that's affecting many people in the Kansas, Ohio, Illinois area of the country, and the symptoms are similar. So we have a lot of overlying illnesses that have very similar symptoms. So if you are presenting with any of these symptoms, please go to your physician and get a consult. Very, very important. I can help with that. One of the things that's going to happen there is that we know areas in the county already that have had a history of problems in this area as far as with low water areas or low lining areas. So the precincts, what we're doing is we're coordinating our efforts that we can only spray. The spraying, did you see the mist? That is an adulticide. That kills the adult mosquito that's flying. And so what we're dealing with that, you could only spray when the wind is blowing less than 10 miles an hour, when it is not raining, and you have to, when it is, the conditions are right with humidity. If it's too humid, that the adulticide will not attach itself to the plants and to the grass to help kill the adult mosquitoes. So what happens is those conditions are very difficult. Here in the valley, it's always windy. The other thing, so we spray very early in the morning, 3, 4 in the morning, or very late at night, 11, 12 o'clock at night, because that's when the wind is the calmest. But the community gets upset because they don't see people doing it, because it doesn't happen during waking hours. It happens when they're asleep, but they want to see it. Trust me, we keep track of GPS coordinates of where everyone goes, because one of the things is, believe it or not, mosquitoes get immune to the insecticide that's used. Okay, so we cannot spray too often in the same location, because within a couple of generations, which is 2 days, they will actually get immune to it and it won't be effective anymore. So that's the adulticiding, the fogging. The larviciding is to kill the little larvae, the eggs that are laid in the water. We put these little briquettes, or like little donut shaped, in standing water, and that puts a sheen of insecticide that kills the larva. That is the most effective method to deal with this, but it's got to be standing water. If the water is rushing or moving, like a canal water or something like that, it will not work. So there's got to be the ideal condition. So the staff is doing that as well with the larviciding.
And if they started that already, did they start?
Oh, yes.
Is that like a regular thing? Or
We've been working on it for the last 3 weeks. We've been doing that. Of course, now we're ramping that up because we've had more water in the last few days. So we're ramping that up a lot more. And so we're all working on that very carefully on that. To me, it's based on, again, we've been in a drought situation, and a lot of it is based on rain and, of course, the conditions. I know that in Reynosa and in Mexico right now, there is a severe situation dealing with dengue, which is another mosquito-borne illness. We had a lot of dengue last year. We had several cases here also last year. This is West Nile, similar but different. But what happens is that a mosquito can have a range of 7 miles, depending on the wind conditions, because itself it won't fly that far, but if the wind will take it that far, you could have a lot of issues with that. But a lot of it is each person in the community, every resident in Hidalgo County is a first responder. Each of us are first responders. We have our commitment to help keep our community healthy by ourselves taking the responsibility for our yards, mowing the grass, removing standing water, spraying ourselves with some DEET product to keep the mosquitoes away, wearing long sleeve shirts, minimize activity during dusk and dawn. But we have the responsibility for that, us as residents. So we all have to do our share, because that's where 80% of this could be controlled if everyone in the community does their share. It's very important.
Communicate that in Spanish.
Yes, sir. Para empezar, me llamo Eduardo Olivarez del Departamento de Salud y Servicios Humanos para el Condado de Hidalgo. Y nosotros, desafortunadamente, hemos tenido un caso de... it's very important that you got to be careful and read all the instructions on there. If you have babies, the infants, the mosquito repellent may be irritating to their skin. So it's very important you review all the information on the can and explaining that. There's also some other more natural ones, like I said, the eucalyptus. And you could go on the internet and actually find some other kind of homemade versions to try to keep mosquitoes away. The best thing to do is be totally aware of the illness and be aware of the signs and symptoms, that if you show these symptoms, go to your physician and get assessed. One of the things I have to acknowledge is our medical community. Our medical community here in South Texas has done a wonderful job. And over the last several years, Hidalgo County Health and Human Services, along with the Department of State Health Services, we have worked hand in hand with our physicians to increase our surveillance capability. And when we look at disease surveillance, we're always watching. We have computerized systems that we monitor our hospital admissions. We monitor physician admissions. We monitor certain things to see certain types of illnesses. In like the case of EVD 68, respiratory illnesses. So we're monitoring intakes to hospitals on respiratory illnesses. In the case of West Nile, or flu-like illnesses, or ILIs, influenza-like illnesses. So we monitor those. And we see spikes, and then we get on it, and we start calling the hospitals, doctors. And then we even see spikes in school districts where we can quadrant it off at a specific campus in the school district. And if we can control it there, it won't spread. So that's how we stay on top of it. But our medical community has done a very, very good job in taking part in providing the analysis, the lab work. One of the things we're asking our physicians is very important for West Nile that they do, and I always mispronounce it, so help me with it. It's an arboviral panel. That arboviral panel is a lab exam that would test for West Nile and dengue. Because when you do that test, we could differentiate between both. But if you only test for one or the other, it doesn't help us, because one may come on negative, but it won't check for the other one. But if you do that arboviral panel, it tests for both. And we were able to determine the West Nile situation. She was asking if what type was it? Was it West Nile or neuroevasive? It was a neuroevasive kind. But she was asking, are these folks traveling? Well, part of our investigative team, in fact, we got some of our folks here. Steve right there is our epi who oversees all the investigations. He and his team will literally go knock on doors and go visit the family, go visit the home, go look at medical records, go visit the doctor, and start looking at a whole history of travel, a history of visitation, because the mosquito could have come from anywhere. It didn't have to be, even though the person may have not traveled. But I tell you what, I was coming from Austin and there was a mosquito. Mel, you and I were talking on the phone. There was a mosquito inside my van as I was driving, and I brought it in from Austin and all the way to the valley. And I remember opening the door and it flew out. And I remember saying, man, that's an import mosquito from the Austin area, you know? So it doesn't have to be the person traveling, it could be the mosquito traveling, you know? And that mosquito could have got into the person's home from a visitor that came or from something else. It could have been the local delivery person delivering something and they had it in their vehicle. So that's how it happens. It doesn't have to be the person traveling. And then the other thing is the birds. Remember, this is a bird illness. So if a bird comes from up north or south, either way, and it's infected, the mosquito bites the bird, and then now the mosquito's infected and it bites a human, guess what? The human gets it. So there's so many variables and combinations.
Well, we certainly want to thank you for helping us communicate. As Eddie was saying, 80% of this can be stopped by the individuals themselves, by our residents, just using basic common sense. We're hoping that they appreciate the fact that this can be a very serious situation, and we've let it get out of hand, and we're hoping that we can get your cooperation. So thank you for being here and helping us communicate.